Hi everyone, in this series of videos, we are going to discuss about the gross anatomy of the urinary system. So we are going to discuss on the anatomy of the kidneys, ureters, bladder as well as urethra. We will start with the first organ of the urinary system, the kidney. The kidney is a retroperitoneal organ. It is a fixed organ, therefore the peritoneum covers only on the anterior surface of the kidney. So we have two kidneys, one on each side. Where is the location of the kidney? It is located in the posterior abdominal wall, extends between T12 to lumbar 3. And the right kidney is slightly lower compared to the left kidney because of the presence of the liver on the right side that pushes the right kidney downwards. So it is about ½ inch lower in position compared to the left kidney. So the kidney has this superior pole, inferior pole, medial border, lateral border, anterior surface and posterior surface. In the medial border, there is a hilum. So hilum is the entry point for the renal vessels. So what are the structures located at the hilum? You have to remember the structures from anterior to posterior. The formula is VAP. So the most anterior is the renal vein. Intermediate structure A, which is the renal artery, and the most posterior structure is P, which is the renal pelvis. Okay. How to identify the anatomical position of the kidney? So first, the hilum should be directed medially, and the structures at the hilum should follow VAP, vein, artery and renal pelvis from anterior to posterior, and the ureter should be directed downwards. Okay, now I'm showing you the plastinated specimen of the kidney. Alright, here is the superior pole, this is the inferior pole, this is the medial border, lateral border, anterior surface and posterior surface. Okay, you can see here the hilum, the entry point for the vessels to the kidney. So the anatomical position, you have to direct the hilum medially, and the ureter should be directed downwards. The structures at the hilum should be VAP from anterior to posterior, so renal vein, renal artery and renal pelvis. Renal vein, renal artery and renal pelvis. Now we will look at the relations of the kidney. We will discuss the anatomical relations on the anterior surface and posterior surface. So we will start with the anterior surface of the right kidney. So now I'm going to remove the liver. So as you can see here, this is the right kidney. The superior pole is related to this structure called the right suprarenal gland. The hilum here is related to the second part of the duodenum. And then lateral to the duodenum, this part of the kidney is related to the right lobe of the liver. The lower part of the kidney, right kidney, is related to the right colic flexure as well as coils of intestine. So there are parts of the right kidney that are not covered by the peritoneal layer. So first is the area related to the right suprarenal gland. Okay, and also area related to the second part of the duodenum, as well as area related to the right colic flexure. So all these three areas, they are directly related to the kidney. Therefore, no peritoneal covering in between. The rest of the parts that are related to the liver as well as the coils of intestine, they are covered by peritoneum of the greater sac. Now let's look at the anatomical relations of the anterior surface of the left kidney. I will remove the stomach, and then you can observe here, this is part of the left kidney. So the superior pole of the left kidney is related to this structure, which is the left suprarenal gland, and then the upper lateral border of the kidney is related to this structure, which is the spleen. And then in the middle, the anterior surface of the kidney is related to this pancreas. And then you can see this sort of like a triangular area bounded by the left suprarenal gland, pancreas and spleen. So this area is related to the stomach. And then the lower part of the left kidney is related to coils of intestine as well as descending colon. So in the left kidney also, there are parts that are not covered by peritoneum, which are the left suprarenal gland, area related to the pancreas, and area related to the descending colon. The part of the kidney, the lower part of the kidney is covered by peritoneum of the greater sac, and then the upper part of the left kidney that is related to the stomach is covered by peritoneum of the lesser sac. Now let's discuss the anatomical relations of the posterior surface of the kidney. Okay, the formula to remember is 4 plus 4. 4 muscles plus 4 small structures. So what are the 4 muscles? First is the diaphragm. Okay, as you can see here, the diaphragm. So the diaphragm is related to the posterior surface of the superior pole of the kidney. And then from medial to lateral, you can see here, this is the psoas major muscle. And then this muscle in the middle is the quadratus lumborum. And the most lateral, you can see these transverse fibers. This is transverse abdominis muscle. So the 4 muscles that are related to the posterior surface of the kidney are the diaphragm, and from medial, psoas major, in the middle, quadratus lumborum, and most lateral, transversus abdominis muscle. The 4 small structures, you can imagine on the posterior surface, they are subcostal nerve, subcostal artery, subcostal vein, and then iliohypogastric nerve and ilioinguinal nerve. So what are the 4 small structures again? First is the subcostal nerve, and then second is the subcostal vessels, which are the artery and vein. The third is the iliohypogastric nerve, and the 4th small structure is the ilioinguinal nerve. The kidney is surrounded by fibrous capsules that help in fixing its position on the posterior abdominal wall. Okay, so there are 3 layers. The most inner layer is called the true capsule. So this true capsule is closely attached to the kidney. And then above it, there is a layer called fatty capsule, which is a layer of perinephric fat. And the outermost layer is the renal fascia, or the false capsule, which is a layer of connective tissue. So this renal fascia, it will fuse with various fascia and connective tissue, so it sort of fixes the position of the kidney. Now you are observing the longitudinal section of the kidney. Okay, here the kidney has two parts, the outer cortex and inner medulla. The outer cortex appears to be dark and red, and the inner medulla appears to be striated. So the outer cortex extends until in between two pyramids. Here you can see very clearly, and this part is known as renal column. The inner medulla composed of about 5 to 11 of these triangular masses, which is known as the pyramids. Okay, the pyramid has a base that is facing outward towards the cortex and an apex that facing inward opens into the minor calyx. So calyx means cups. Okay, so the part of the apex that opens into the minor calyx is known as renal papilla. So minor calyx will fuse with another minor calyx, so 2 or 3 minor calyces will fuse together to form one major calyx. Okay, so 2 or 3 major calyces will join together to form renal pelvis, and then renal pelvis will continue downward with ureter. Okay, and here you can observe one stone in the major calyx. So the calyces of the kidney contains pain receptor as well. Also the renal capsule that contains pain receptor, but most of the afferent nerve fibers that carry sensation, they are located in the renal pelvis. Okay, regarding the vascularization of the kidney, it is divided into 5 segments. Okay, so this upper part is known as the apical segment, and then followed by superior segment, and then here is the middle segment, and here is the lower or inferior segment. Okay, arterial supply to the kidney is from renal artery. So this renal artery, it has 2 divisions. Now I'm showing you the anterior division that supplies the 4 segments that I've mentioned earlier, the apical, superior, middle and inferior segments. And the posterior division will supply the posterior segment, which is the 5th segment, posterior segment. So each segment will receive a lobar artery. So lobar artery will split around the pyramid and surround the pyramid to form the interlobar arteries, and then they fuse together at the base of the pyramid to form arcuate artery, and then they give out small branches known as interlobular arteries to supply the cortex. Okay, now you can observe in this model the arterial supply and venous drainage to the kidneys. Okay, so the renal artery is a branch of the abdominal aorta at the level of lumbar 2. So the renal artery will enter the hilum, and this one forming the anterior division of the renal artery. And you can see here, this is the left renal artery, which is shorter compared to the right renal artery, because the right renal artery has to cross behind this inferior vena cava. Venous drainage from the kidneys will go through the renal vein that drains into inferior vena cava. And you can see here the opposite of what happened to renal artery. The right renal vein now is shorter compared to left renal vein, because the left renal vein has to cross in front of the abdominal aorta. The nerve innervation of the kidney comes from the renal plexus. So renal plexus is formed by filaments from the celiac ganglia and plexus, aorticorenal ganglia, lower thoracic splenic nerves and first lumbar splenic nerve, as well as aortic plexus. And renal plexus will cause around the renal artery to reach to the kidney. Now I'm going to explain the functional unit of the kidney. Each kidney consists of nephrons and collecting duct. So the nephrons is concerned on producing urine, and the collecting duct is concerned with concentrating the urine. So in each kidney there are more than 1 million nephrons. So each nephron consists of renal corpuscle, and inside renal corpuscle we have the glomerulus. Now I'm going to demonstrate the structures forming the glomerulus. As you can see here, this is the afferent arteriole. So the afferent arteriole receives blood that comes to the kidney. The blood that goes to the kidney will go through afferent arteriole to feed the glomerulus. The afferent arteriole will break up to form channels of capillaries that anastomose with each other to form this glomerular capillary tuft. Alright, what is so special about the afferent arteriole is that it has a modified or specialized smooth muscle cell surrounding it, which is known as juxtaglomerular cells, and they are baroreceptor cells, meaning they can sense the pressure coming through the afferent arteriole into the glomerulus. For example, if there is a case of blood loss or hemorrhage, so blood coming to the kidney will be low, or renal perfusion is low. So when renal perfusion is low, so pressure going to the afferent arteriole is low, the juxtaglomerular cells will sense it because it's a baroreceptor cells. So it will activate the renin-angiotensin system, RAS. So juxtaglomerular cells will release renin. Renin is an enzyme. So when JG cells release the renin, as it goes into the blood circulation, it will convert angiotensinogen, which is a protein released from the liver, into angiotensin 1. Okay, when angiotensin 1 cross the lungs, okay, it will be converted by the cells in the pulmonary into angiotensin 2. So angiotensin 2 will start the sympathetic reflex that will correct the blood pressure with various physiological mechanisms. Okay, so that is one mechanism that will activate renin-angiotensin system through these juxtaglomerular cells. Okay, and then here you can see this is the efferent arteriole where blood will go out back to the system. And then here you can see special cells also. These cells are known as macula densa. Alright, so this macula densa is part of the distal convoluted tubule. Alright, so it is more dense compared to other cells of the distal convoluted tubule, so that's why the name is densa, okay, macula densa. And macula densa also part of the juxtaglomerular apparatus, which actually sense the concentration of the sodium. Alright, so what forms the juxtaglomerular apparatus? The juxtaglomerular cells surrounding the afferent arteriole, macula densa cells, which is part of the distal convoluted tubule. Okay, so this macula densa, as I've mentioned, it detects the concentration of sodium. So for example, continuation from the story just now, the blood loss. Okay, since renal perfusion is low towards the kidney, meaning GFR is also low. All right, so when GFR is low, the filtration is low, blood that goes to the proximal convoluted tubule is also decreased and slow. So when blood, okay, you know that a proximal convoluted tubule, the function is to reabsorb sodium. So 65% of the sodium is reabsorbed in the proximal convoluted tubule. Okay, here you can see proximal convoluted tubule. So when the blood flow is, renal perfusion is low towards the glomerular capillaries and GFR is low, blood flow to the proximal convoluted tubule is slow, so more sodium can be reabsorbed, because you can imagine when the flow is slow, you can take up more of the particles. So sodium is more reabsorbed in the proximal convoluted tubule. And then as it goes to the distal convoluted tubule, the sodium concentration is already very low. And this will be sensed by the macula densa, because the function is to sense the sodium concentration. So once macula densa senses that sodium concentration is very low, it will send signal to the JG cells also to secrete renin. So the RAS system is also activated from the detection of the macula densa. So surrounding the efferent arteriole and macula densa and efferent arteriole, there are extraglomerular mesangial cells. Okay, so they are known as Lesse's cells or Pulkison cells. The function is not clearly understood, but they said that probably they are involved in erythropoietin. Okay, now let's focus on this glomerular capillary tuft. As I've mentioned, they are anastomosing capillary channels, all right? So, as you know, the main function of the glomerulus is to filtrate the blood, so it must have filtration barriers. Okay, so the glomerular capillary tuft, they are formed by three filtration system. Start from the innermost layer, which is the capillary endothelial cells that surround the capillary. Okay, capillary endothelial cells. And you have to know that the capillary endothelial cells, they are fenestrated capillaries, meaning they have thousands of holes, all right, with a very small size of the holes, all right, so blood can pass through and get filtrated. So that's why the name is fenestrated capillaries. Okay, another layer is the basement membrane, and the outermost layer is the visceral epithelial cells that have food processors, and they are known as podocytes. Okay, and of course, the visceral epithelial cells, the size of the holes much smaller compared to the capillary endothelial cells. So these are the three glomerular barriers for the filtration of the blood in the glomerulus. And the factors that determine what substance or molecules that can be filtered depends on two factors: the size of the molecule as well as the charges of the molecule. Okay, and of course, the holes of the fenestrated capillaries, they have small holes, small size, and big particles, for example, RBC, white blood cell, platelet, they cannot be filtrated in the glomerulus because the size is big. Another factor is the charge. Okay, the capillary endothelial cells, they have negative charges. Basement membrane also have negative charges, and the visceral epithelial cells, they also have negative charges. Okay, what is the function of these negative charges? So, for example, plasma, for example, albumin. Albumin, they have the right size to be filtered through the glomerulus. However, albumin is not filtered in the glomerulus. Why? Because albumin carries or surrounded by negative charges. And you know that the glomerular filtration barriers, all the 3 layers have negative charges. So, they repel the albumin. So, albumin do not get filtered. Okay, now you can see this is the Bowman's capsule. So the Bowman's capsule is surrounded by these simple squamous epithelial cells known as the parietal cells. And the space between the glomerular capillary tuft and the Bowman's capsule, we say it's known as Bowman's space. So the parietal cells will continue with this tubule, which is the proximal convoluted tubule that contains the cuboidal cells. Alright, so this is known as the urinary pole, and this is known as the visceral pole of the glomerulus. Okay, so you know that the proximal convoluted tubule reabsorbs 65% of the sodium. Okay, from proximal convoluted tubule, it will continue downward, straight downward with this descending loop of Henle, and will continue as ascending loop of Henle, and ascending loop of Henle will continue with distal convoluted tubule. So you can see here there is part of the cells of the distal convoluted tubule that is located near the visceral pole of the glomerulus to form the juxtaglomerular apparatus, which is the macula densa. And distal convoluted tubule will continue with this collecting duct. The collecting duct here, this is the collecting duct, will open into the calyces of the kidney. And then as you can see, the proximal and distal convoluted tubules, they are located in the cortex of the kidney, and the loop of Henle, the ascending and descending loop of Henle, they are located in the medulla of the kidney together with the collecting duct.